morning, everyone. I'm Dr. Venice, a dermatology resident in Germany, and today we are talking about the perfect skincare routine for rosacea patients. Rosacea is a common inflammatory condition to the skin. Even the charming Snow White had it. You know this facial flushing or redness which appears on the cheeks, forehead, nose, and chin, maybe when you exercise or you are embarrassed sometimes. With rosacea patients, it is usually accompanied with blood vessels or small bumps and pimples that look like acne. Rosacea can also affect the eyes or thicken the skin of the nose, causing it to look bigger. And the difference between rosacea and acne is that we don't usually find little blackheads or comedones with people suffering from rosacea. That's a sign for acne. The cause of rosacea is not known. It can be due to genetics, a destroyed skin barrier, or the role of microorganisms called demodex mites. There are also many triggers which can cause flare-ups, such as sun exposure, heat, alcohol, spicy food, maybe stress and exercise. And these triggers may differ from one person to another. That's why I would recommend writing a rosacea diary. Rosacea is not curable, but it is treatable with the right medication, gentle skincare, and by avoiding things that cause flare-ups. There are many wonderful ingredients that help treating rosacea in an over-the-counter treatment. Please look for products that help reduce the redness, soothe and calm your skin and restore its barrier, and also, which is very important, fragrance-free, because products with fragrances can irritate your skin. We'll start with cleansers. A great option is Cetaphil Soothing Foam Wash, which I use myself. This one is a gentle cleanser which contains caffeine, and when used topically, caffeine can help reduce the redness by constricting these blood vessels, and it also calms your skin. Another option is Avène Tolerance Extremely Gentle Cleanser, which is a wipe-off cleanser. You could simply apply it to your face and then remove or wipe off using a cotton pad. Both of these products are fragrance-free, paraben-free for some people who have certain allergies, for example, and also help hydrate the skin and restore its barrier. Step 2 after cleansers could be using a serum. A great one for a rosacea patient would contain azelaic acid. This ingredient is phenomenal treating rosacea. It has antimicrobial, anti-inflammatory properties. We usually prescribe it in practice, and I would recommend the ordinary suspension, which contains 10% azelaic acid. Now with a prescription you'll get a higher percentage, 15 to 20%, but ordinary is a great option which is affordable and you can simply get it over the counter. The ordinary caffeine eye serum is actually amazing. I would recommend this not only around the eyes but all over the face. And caffeine would work here as a vasoconstrictor and help reduce the redness and calm your skin. Step 3. Moisturizers. During the day, I would recommend a gel-like or a cream moisturizer under your sunscreen and some thick ones at night. I really love Avène Tolerance Control Cream, which I use myself. It helps hydrate the skin and also reduce sensation of discomfort like burning or tingling sensation, which rosacea patients often complain about. And there is also Cetaphil Moisturizing Cream. I use it too, and it is especially formulated with many vitamins and antioxidants such as vitamin B3, B5, and vitamin E. Now, some of the greatest moisturizers for rosacea-prone skin for nighttime are the ones who have ceramides in them. They make a really good barrier and skin support, and CeraVe is my favorite. This one is great. It is thick, it goes on really well, locks everything in, And I really love how it makes my skin feels when I wake up. For rosacea, that's a wonderful moisturizer for nighttime, and even for my acne prone skin, it works wonderfully. You could also simply use Vaseline or petroleum jelly, but I would recommend this only at night. Now, let's talk about the most important step ever, sunscreens. We all know we should use them daily, even on cloudy days, and physical slash mineral sunscreen are better suited for you as a rosacea patient than chemical sunscreens because they are not going to be potentially irritating. And Steam Photo Ultra Redness is a great option with SPF 50, which I use myself. It helps hydrate the skin and reduce the. Now, please notice that it is allowed to use tinted sunscreens to cover the reddened skin areas. And Cetaphil Redness Relieving Daily Facial Moisturizer with SPF 40 is a great option, which I use myself when I have a pimple somewhere. And in terms of prescriptions, we have azelaic acid, ivermectin, and metronidazole. And a great tip for you, we could combine these three together for the perfect formula. Ivermectin is an antiparasitic which helps control the number and activity of Demodex mites, and metronidazole is an antibiotic which is used for its anti-inflammatory properties as well. For more serious rosacea affecting the eyes or for rosacea with many bumps and pimples, you may be prescribed an oral antibiotic pill such as doxycycline. Pound nose or rhinophyma usually require laser treatment or a plastic surgery. Laser treatment can also help improve the look of enlarged blood vessels and control the long-term redness of rosacea. Now that was everything about rosacea today. I hope you guys found it um, helpful for you. Please do not hesitate to leave me a comment when you have any questions. I would be glad to answer them.